On Wednesday, February 28th, 2018, we're going to have our second Measure B meeting, and we'll start with roll call.
Okay. Janine Miller.
Here.
Jan McGordy.
Present.
Carmel Angelo.
Here.
Ace Barish.
Here.
Ross Liberty.
Here.
Lloyd Weir.
Here.
Mark Myrtle.
Here.
Jed Diamond.
Here.
Shannon Riley.
Here.
Thomas Allman.
Here.
And Donna Machete.
Muschetti.
Spaghetti like
Present.
spaghetti.
I'm just looking for trouble.
You'll all get it one of these days.
So thank you, everybody. We are all here, all 11 of us on time. I appreciate that. In government, it doesn't always work like that, and it's appreciated when it happens. We're going to do the approval of minutes. I do want to say that there were two grammatical errors that we're going to correct on the minutes. Unless somebody has a problem with it, I will tell you that on page 4, in paragraph 1, 2, 3, 4, we're going to change the word member to members with an S. And on the first paragraph, the last sentence says, and give things we need to work on. I'm going to add the word on.
What page is that?
That was page 6, I'm sorry.
Okay.
Is there anybody else who would like to comment on minutes or make a motion to accept the minutes as corrected?
I move to accept the minutes as corrected.
Motion moved. Anybody have comments? Question? All in favor? Oh, wait, there's a second.
I'll second.
Second, Sharon. All in favor, say aye. Aye. Any opposed? Hearing none, so carried. Thank you. And thank you to Donna for correcting the minutes and taking time to read them. Thank you very much.
Thank you.
That's a big deal. I do want to say that on the agenda, I think it requires a motion, but I would certainly like to entertain a motion to move item number 5, public expression, to be in between 2 and 3. So if there's members of the public who would like to address us, they can address us and stick around for the rest of the meeting, or if they have other things to do, they can move on.
I so move.
Diamond makes a motion. Is there a second?
Second.
Second, Dr. Barish. Any questions, comments? Yes?
Is that a permanent change on the agenda?
It's going to be a permanent
Okay.
change on the agenda.
That's a good idea.
That's not what the motion is, but next month it'll be a permanent change on the agenda. All in favor?
Aye.
Any opposed? Hearing none, so carried, which coincidentally takes us straight to the public expression. We welcome public expression. What I would like to do, if possible, if you could clearly state your name so we can get it for the minutes. And it's 3 minutes per person or up to 10 minutes per topic. So is there anybody who would like to do public? We have Margie Handley.
I'm Margie Hanley, president of the Frank R. Howard Foundation, and we're here just to give you information as to what the Howard Foundation has done to date to let you know that the old hospital in Willits is a viable option. First we contacted the county to see if they had an interest in it, and they did, and Carmel was able to get a hold of the state people, and she brought them over to look at the facility. They did. And we did receive a positive response. They thought that it could be made into what we need. We needed to do a feasibility study, or the county needed to do one, to be sure the hospital could be used and they could meet all the requirements. But the county was not able to pay for it, and so the foundation agreed to cover the cost. We asked the county to come up with a plan. If they could have the ideal building, what would it look like? So Carmel, Camille, Tammy, Janine, and Janelle worked as a committee directly with the contractor and their staff to come up with a plan. And we're passing the plan and our talking points around so that you'll have it. The foundation spent $48,000 to get the plan and to determine a cost of what it would be to build the facility. The cost came back to be between $11 and $14 million, depending on which option they choose to build. This process took almost 2 years. We collected 1,000 signatures in Willits in the 95490 area code, saying that they would like to have a mental health facility there. I was able to get a letter from the school board saying that they would not object to the facility, given that Beckle Grove School is nearby. So we have done our due diligence, we have a plan, and when you are ready, we could have a facility built within 18 months. So I just wanted you to have that information.
And Margie, thank you very much. Just for the general public information, I want to make a statement that what you're talking about, because it involves members of our committee, was initiated and accomplished long before this Measure B was even put in front of the voters. Is that correct?
Part of it, yes.
Right.
Yes.
So this was done between the county and the foundation,
Yes,
okay, before Measure B
yes,
passed.
yes,
Okay.
yes. Before the second Measure B passed. I think did we start it before the first one
Yes,
passed? Yeah,
yes.
we did.
Well,
Yeah, it's been a long
Yeah,
time.
yeah.
We worked on it for a long time. Okay,
2 years of my life.
yeah, severe. Thank you.
Okay,
Hey, how are you?
thank you. Is there any other,
Public comment, you have any?
welcome, sir, if you could please state your name?
Yes, my name is Gregory Sims. I'm a psychologist.
I'm sorry, hold on one second here.
I'm sorry, my hearing's not all that great. And were you saying that this is, what was discussed was a new building, creating a new building?
No,
or
using the
revamp?
old
You-
hospital as a facility. We
okay,
just wanted to be
Updating,
certain.
or whatever, okay.
Yeah.
I'm sorry, thank you.
I apologize, go ahead, sir.
Gregory Sims, and I'm a retired psychologist. Actually, I'm volunteering my time for some of the folks who are on the street and through some of the current agencies that are existing, McCavan and others. And I've worked with the youth in a number of facilities, so over the last 20 to 30 years, actually more than that. But that's been a large part of my practice, and one of the things that I have said to Sheriff Allman and others was that we need to have more of a systemic working with individuals, adults or children, who are having difficulty managing their interface with a society that in some ways is having difficulty manifesting our interface with them. And there are quite a number of adaptive, gifted, caring people within the population that, as things are now, as good as some of the efforts are being made, a lot of them are dropping between the cracks. And so when this committee was formed, I was very happy that you are together. And I'm hoping that there'll be some way to interface with the community, with the psychiatry, psychology, social work, the various, what I don't want to call us experts. I want to call us, individuals who are seeking, like you are, like the clients are, to find a way to make this work. And now it appears we're going to have some money to be able to do that. And my statement is, I would like to find a way, and I don't know if I should make access through the 5th district appointee or through the chairman, or how can those of us, and I should say that I'm currently a visiting scholar now at Stanford in the Developmental and Psychological Sciences program in the School of Education, and I'm working on a proposal for the integration of services for Mendocino County or any other counties. It's slow going, and at the same time, I'm up to about 200 pages. I hope to be finished with it by the time I finish in June with this appointment. But I would like some guidance. And I've actually sent off a summary of what I've been doing for the committee. I think maybe if you have a secretary, it went to the secretary. But I'd like some, however now, or written, or however might happen, how can I help?
Dr. Sim, thank you. Actually, you sent an email that we have a copy for all of our members to have. I'd like for you to stick around at least for the very first item that we're going to discuss.
Well, I'm here till 3.
Good, okay. And the first item we're going to discuss has to do with what our mission is and what our goal is, because the voters passed, thankfully passed Measure B, and our goal is to make recommendations to the Board of Supervisors, who have the legal authority to expend the money, the taxes which are collected, for the brick and mortar or the facilities that we believe will enhance the mental health services provided throughout Mendocino County. And I don't know if you've had an opportunity to express your thoughts to the Behavioral Health Board, but certainly the Behavioral Health Board has more of a responsibility and the ability to make recommendations to the Department of Mental Health for ongoing programs and changes in their services. And I've had an opportunity to read your well thought out email, and everybody's going to have a copy of it. But what I've seen is in your email is it's more of a program recommendation than it is for the brick and mortar of what this body has been assembled for. So yes, there are additional monies, around approximately $1.7 million a year, which will be added to the mental health budget for the improvement of mental health services and implementation of the alcohol and other drug treatment programs. But for the most part, our focus is the brick and mortar outlay. But everybody's going to have we already dispersed those?
It's all in your packet.
So your email has been dispersed in the packet already. So,
Thank you.
You're
And just to respond, I know it's beyond my 3 minutes, but I think that a large part of what will be helpful for the people in need is the brick and mortar. So
Okay.
in any way I can have input into that, I'd like.
thank you, sir. Thank you very much. All right, so is there any more public expression? Okay, we will close public expression and move on to item 3A, the Measure B ordinance. Discussion of members' tasks to read and understand the committee's role in accordance to the ordinance. This was put on the agenda. It's not going to be on every agenda. However, I'd certainly like to hear our comments, everybody's comments on if you see anything of our role outside the role of how I explained to Dr. Sims of what our role is. But are there concerns? Are there questions? Are there irregularities that you see that are happening with what our intended purpose is?
Oh, I'm supposed to, you read Ross.
Ross?
So one of the things I noticed in reading the ordinance is that a maximum of 75% of the monies can be used for building a facility. So when I read that, I take it to mean that it's not a given that we're going to build a facility or buy a facility. I will say if we're going to buy one, I think that's an odds-on favorite there, that Howard Memorial is. But I don't think that the ordinance indicates a certainty that a building is going to be built, because it's a maximum of 75% of the money raised in the first 5 years can be spent for that. And there was some discussion too. I mean, I think I'm here kind of as a fiscal conservative, right? I'm type 1, and there. You know, when there was some discussion about a training facility, and when I read that measure, I felt that a training facility could well be a conference room inside the main facility. I mean, it doesn't have to be a separate building. It doesn't have to be we have to be careful. You know, the monies aren't unlimited, and as you pointed out to me some time back, right? I think we spend some $27 million a year already on mental health. I mean, we're not bringing that much money to the table that we can't be cavalier about it. We've got to be very careful with it. And so, you know, do we need a new brick and mortar presence? Is there a cheaper way to do that? And can we use that monies for better elsewhere in mental health? And then also, does that facility, can a training facility just be a a training room inside the main facility. So, that's all I got.
Donna?
Oh, I just want to say I agree with the training room thing being part of a conference room, but we do have to remember we are in charge of 25% of the funds for services, and we do need to remember that.
Right, the
Yes.
corollary to that 75%.
I'm not, I'd have to read again, but as I remember, the training facility was one of the things that was specifically stated in Measure B, whether it's an actual building or not. But one of the things that I would like to know is whether that, I mean, I think what Tom mostly had in mind was training for management of crisis and training of first responders and law enforcement were the people that most frequently deal with it, which I think is extremely important. But then there are the other questions about all of the people we're going to have to train to staff the facilities, whether that is going to be included in this facility as well, which would suggest that it's more of a building and a conference room. But you know, just what this training center is going to include. That's all.
Anybody else want to comment about what really truly what our purpose is? Because we're going to be, just to remind everybody, the first taxes are going to be collected in 32 days on April 1st. And that is when, and we'll have had 3 meetings under our belt by then. And one would think that in 3 meetings that we will have been able to become cohesive enough to give, be ready to give some good recommendations to the Board of Supervisors so we can look forward. And while our funds are not unlimited, we are going to receive funds which this county has not ever been in the ability to build, you know, a psychiatric health facility, if that's what is decided to do, or a training facility ever. And I can assure you that when I was collecting signatures and supporting this and getting voters to understand it, a training facility was discussed for first responders, for parents, for nurses, for the mental health technicians throughout our county for the purpose of having a local site. It's much more in a conference room in my view, where we're going to have genuine training there of not sitting into a classroom training, but physical training, whether it's protecting law enforcement, learning other techniques other than tasers and firearms to deal with mental health people. And it's fair to say that in a room like this, a conference room like this, that would be a very difficult thing to do unless you brought in a bunch of equipment and you were ready to move out the equipment so that someone else could use it for a meeting room. So my view of a training facility is a training facility, but that's just Tom Allen's view. And it's going to ultimately be up to the Board of Supervisors, but I know that's what I told the voters. So, all right, and the first meeting we had last month, I'm sorry, Jan.
So I would just like to comment on the question about a facility, a psychiatric facility of some sort, which is the main thing lacking in our county. And if you look at the funding, that's where it goes, is to ship people out. It's a problem because law enforcement has no place to take people here. So I think that would be something that's not questioned, and I see the word is may be used, but it should be will be used.
What they signed on for was what's written. I mean, no matter what we said, no matter what arguments we make, what they signed on for with our customers, right? The people that are writing the check, they signed on for what is written.
Yeah.
Okay.
So, but that was the thing. The other thing in the training facility for education, I think having a central place that could be a regional place where perhaps we could take, you know, other counties in and make it a profitable situation is a good idea. That it should be within some scope of serving a purpose, like the CPI program needs a certain number of square feet. However, we don't need a new building to provide education at this point, and we've been pushing for 4 years now to have crisis intervention training for law enforcement and first responders so that they have some other knowledge than shooting first and asking questions later, and that's not something that we have to wait for a building to be built for.
Jed?
Yeah, I just want to comment to both your comments. I agree with Ross that we need to be wise about how we spend any money. You know, I believe that. I want to say, you kind of asked to put together like a suggested mission statement. So that's kind of what I put together. And I just want to say my bias, I'll tell you up front what my bias is one of my kind of side jobs for the last 17 years has been working for the county public guardian's office. So I have done the conservatorship reports with other people. I'm not the only one, of people who need some kind of care that are now being seen either by the sheriff or in the emergency rooms of the hospitals and then get sent out of the county, which as a clinician, it's not very beneficial to the patient when they're set out and they lose connection, and that's part of why they keep going back over and over again. Plus, it's really expensive. I don't know, they probably know the exact breakdown of what it costs to send people out. So it's not like we're not spending the money already. We're spending a lot already, but getting sent out. So my kind of go at a mission statement was this, and I'll just put it out for consideration or revision. I said, the mission statement of the Mental Health Citizens Oversight Committee is to recommend to the Board of Supervisors, number one, the creation of the best residential behavioral health facility to diagnose and treat patients who have been seen in the jails, emergency rooms, or being sent out of county, or other people who need our help. Number two, the creation of a regional training facility to improve the delivery of mental health services in the county. So that's my sense of what this body is being asked to address. Doesn't exclude anything you said. We still got to spend our money well, and if there's ways to do that in a cost-effective way. But from my perspective, both as a clinician and somebody that's been seeing these people for 17 years, we really do need some kind of a residential program rather than, well, we have one. One, it's called the jail. That's where a lot of them are. The other's called the emergency room. So the other is the streets and under, behind houses. I mean, you see people, so they're there. We just need, I think, a better way of treating, and that's my sense of what the, what our mission is to address those issues.
Yes, Mark?
Yeah, me as a taxpayer and a citizen of Fort Bragg, I seen it as looking around is that we don't really have a good way of treating the homeless and the mental health, and I think the citizens in general feel the same way. And what we all need to decide in this committee is actually what facilities we actually need, because each person or each stakeholder here has an interest in what they want. So with the Kemper report, which I read, it's talked about specific issues and problems that they wanted to get to. But long story short is they identified a lot of problems within the system. What we need to decide, and we need to talk to the stakeholders about what is actually needed and let those stakeholders all chime in, and then we decide what facilities need to come from that. And it's clearly stated in Measure B that I read is that we need to build some type of infrastructure of some part. And that's what the 75% was dedicated for. But what's not clear is what's truly needed. And that's where I think, hiring a consultant to make a needs assessment to put all the stakeholders that are involved in mental health and give their input, bring it to us, and let's decide. And I realize that might be a little slower process than everybody here wants to to do, but I think that's a fiscally responsible thing to do, and in the long term, the right thing to do.
Doctor?
I agree with you. I think that, that it's good to have an overall strategic plan. I don't agree in that people don't have any concurrence on what is crucial at this moment. I mean, I think that crisis services are crucial, and I think that one thing that he did say, he mostly talked about contractual problems in the Kemper report, but one thing he did mention, which is the same thing as Jed said, was about how much money we're spending to send people out of the county and how inefficient, and not just in terms of money, but in terms of continuity of care of people being sent out, that's really detracting from what we have to spend on other mental health issues. I think that people can overall agree that, and I think that the priority would have to be crisis, because that's what's not going to go away for sure. It'd be nice if we could hit upstream of the crisis as best as possible. But to me, that leaves two possible prioritized buildings. One being a PUF that we've talked about, or a PUF-like facility, which I can talk further to if you want at the moment, unless everybody's interested. But or having a crisis residential treatment. And the difference is the PUF is locked and the crisis residential is not. The PUF is 72-hour maximum, the crisis residential is 30 days involuntary. You know, I think both of those things are at the top of the list. And one thing I would like to see, and I completely agree with you about being strategic and hiring a consultant like Kemper to look at it, but I would like to at the same time begin deliberations about what we know is needed, and do both at the same time.
Jan?
I think it would be really wise if this gathering formed some ad hoc committees to look at these different things. So for example, the facilities, there's different kinds of psychiatric facilities, and I think it would be really good for all of us to have an understanding exactly what they are, because it's really confusing, what the staffing needs would be for each type of facility, because my understanding is a PUF unit is really hard to achieve without a psychiatrist, which we have been unable to get in this county. So we need some committees to help this work, and just, you know, having an open meeting where everybody gets to talk isn't going to accomplish the work that needs to be done, in my opinion.
And I'm going to assume that most of us have been through the recent Brown Act training. With that, and County Council Catherine Elliott put it on, thank you very much. With that, we certainly discussed ad hocs, and with all due respect to the 5 members of the Board of Supervisors, I think that we've seen ad hocs peak, and they have peaks and they have valleys, because when you have a whole lot of ad hocs, seems like things are slowing down, and our board has decreased the number of ad hocs, and things are a little bit more efficient. But I welcome an ad hoc. You know, the fact that the Howard Hospital Foundation has expended some money and made a good presentation certainly would lead to an ad hoc to work with them to at least tour the facility and see what they have in mind, as well as, you know, the Director of Mental Health was here, and having an ad hoc of what we need and or what we have in this county, and what we believe the statistics show we're going to need. You know, the fact, and Mark brought it up, that Fort Bragg is the coast is a very important part of where Measure B is going. And this is not the county of Ukiah, this is the county of Mendocino, and we have to look at the numbers on the coast of what is the coast going to be able to, what could we recommend to the Board of Supervisors for the coast to have that's going to improve the quality of life for the patients and the patients' families and community on the coast. There's a lot of things that were going, and last meeting I certainly discussed the need to, the possibility of having a needs assessment, and there was criticism both at the public and on this board of saying maybe we don't need that, maybe we already know what we need. And Mark, what you said is to get a short-term professional to say this is what we need inland, this is what we need on the coast, these are are options we have, and this is maybe how much it's going to cost. I don't know if we could find anybody who would be that specific for what we need. But I, as a chair, I would welcome ad hoc committees of up to 3 people. We can have up to 5 on an ad hoc, but trying to coordinate 5 people's schedule is not the easiest thing to do. But having an ad hoc of up to 3 people to do exactly that, Jan, is the right way to go, I believe, in my.
Yeah, I think we should have an ad hoc for options, facility options, so that people have, and they could make a report back so everybody has a good understanding of what there is. And then the second one would be staffing.
Staffing.
What kind of staff is available? If we don't have the right kind of staff, how can we get people trained? How can we have residential, programs here so we can get the psychiatrists or the psych techs or whoever we need? But I mean, staffing is a huge issue.
Anybody else want to weigh in, Carmen?
Thank you. I actually would like to weigh in because I really believe I've been involved in this issue for some time. A few years ago, the board actually tasked me with working with the Howard Hospital Foundation. And this is the full board. This is not just one supervisor in the 3rd district. It was the full board. And what they wanted me to do was work with Howard Hospital Foundation and really look at Howard Hospital as a facility, as a psychiatric facility. And so that's when we started the discussion. It was so long ago, Stacy Cryer was here. And so it was Stacy and myself that actually started talking with Margie. At that time, I don't know that Arnie was even on board. And we began to just talk about the building. And so from there, years have passed, and the board's direction has always been to look at that facility, and they have always been interested in that specific facility. The reasons for that have been the location, that Willits is the center of the county. So, you can come over 20 either way from the coast, and we all know that. So we did do that discussion, and at one point then we brought in, Janine was involved, but then we brought in Tammy and all that, and so what I'm really trying to say is that whether this is used, whether Howard Hospital is used, whatever decision is made by this committee, there has been a lot of work, groundwork done on this building, and I would also say that this is not easy. But we will be dealing with the state as well. So Janine, I'll look to Janine, myself, and either Tammy or Ann, because whatever is decided, if this committee decides to move forward with some type of facility, we will be working with the state. And I want to say that I'm really pleased with the work that we did in laying the groundwork with the state, because we got full support from the state at that point in time, that they were more than willing to look at this building, to work with us on that building. So I just want to say that, because if you haven't been involved in this process, it is absolutely not easy to work with government, first of all. And then you're talking about different arms of government. So a lot of work has gone into this already. I don't know what this committee will decide ultimately, but we know that the state was in support of this building. This blueprint was actually put together by county staff, and what happened, Sheriff, is when Measure B passed, is when I had to call Margie and say, I can't promise you anything right now, because before we had Measure B, we obviously were very interested in this facility. Measure B gives the county a lot more money, and so I don't know where we're going to go from there. But as far as cost, 11 to 14 million to renovate this building that would be in the center of the county might really be a very practical and viable solution. So thank you for listening.
Thank you. Doc?
The other thing is, in answer to Jan, I mean, I completely sympathize with what you're saying, but there has been a lot of work. I mean, maybe we've already had an ad hoc committee investigate this. And I think that Camille and I have been working on this for several years. And I think that we might be able to, rather than having an ad hoc committee begin again, we might be able to just have a presentation from Camille. Because we've talked about, for example, a psychiatric hospital as opposed to a pub. in the psychiatric hospital involves higher level of staffing. A PUF doesn't necessarily mandate a psychiatrist there all the time. A PUF, you can have, a psychiatric hospital, you can charge higher rates, but you also have to pay higher salaries because of the higher level of staffing required. However, a psychiatric hospital has to be affiliated with an acute hospital, and that may occur, for example, in Willits, associated with Howard Hospital. However, because Howard has a special designation limited it to 25 beds, it can only have 10 psychiatric beds, which would not make it cost effective. So it seemed like after going around that path, we decided that a PUF was probably going to be the most cost-effective way to go. So I think that's what you were referring to, is the different designations.
Yeah, that's correct, and that's why I think it would be good for this committee to have its own people, have a little ad hoc committee and get all that information again.
Right, well, that's fine, I just wanted to mention that. But and then the other, as Carmel said, the other issue not only is the geological facility of the placement of Howard Hospital, but the fact that it would be a third to half the cost from building from the ground up.
Any public members like to weigh in on this? You have to state your name.
Good afternoon, Camille Schrader with Redwood Quality Management Company. I just want to reiterate what Ace spoke of. Apparently there were parallel conversations happening all along. We, the emergency rooms in Ace's case and RQMC in the case of crisis, we're dealing with and continue to deal with. As we speak right now, we have a 16-year-old that is so autistic, nonverbal, out of control, third client so far that none of us, our county social services or mental health, are going to know what to do with. So every day we're dealing with very, very, very difficult situations. On the adult side, there's anywhere between 4 and 7 a day that our ERs are handling. Part of the answer is the crisis center, which is a different conversation, but in all those cases, they need to go to a psychiatric facility. Some of them will be able to return to us within 3 to 10 days. Some of them really need a longer-term locked facility that's more secure, and our sheriff certainly is aware of this, and who ends up being the default is the jail. So we actually launched about 2 years. We worked on it. We worked on it with the Adventist people who ran St. Helena while she was here before she got a job in Florida, and did a ton of this research. I can try and find it in my piles between moving and sort of go over the definitions of the different kind of options. The reason why we landed, and then coincidentally, apparently the CEO's office and Stacy, as Carmel described, were doing their own research and doing their own sort of
the board.
work by direction of the board regarding Howard Hospital. So we kind of ended up convening into the same common sense kind of plan from different directions. And the reason Howard Hospital became beneficial for us and why we kind of looked at, okay, what would the physical plant be possible? At first it was overwhelming because it's huge, and you definitely, it needs, anything that you have up there needs to be secure because of the neighbors and where it sits, and it's next to a school and all of the issues that are unique to Howard. It feels like we're getting 2 for 1 here. We're getting if it works, and again, there's a lot of obstacles to be and challenges to be worked out, but the 16-bed psychiatric facility, which is cost effective, and a 16-bed locked mental health rehabilitation center that's certified through Medi-Cal, which, by the way, I think there's one in California, for longer-term clients who need more than the 30 days, is a pretty wonderful thing. They all need psychiatry, they all need nurses, they all need psych techs. That's why we need a training center, and we need linked to our community college. All of them are, I don't know that is, as we've experienced with taking over crisis, if you're willing to pay $200 an hour, you'll get a psychiatrist. So that challenge we will try to figure out when we get there. But I just wanted to give a little bit of the convening of all of the things that were happening previous to Measure B, to try and solve the problem of psychiatry for Mendocino County. And I do also want to mention, the initiative sort of clearly says we're working on a psychiatric facility of whatever it is, and we're working on a training center. Those 2 things are really clear. I love that we're beginning to work on at least the things that the Measure B's have been very specific about. So I thank you for that.
Okay. Hold comments for 1 second, and then you're next, Jed. I do want to form a 3-person ad hoc committee for the purpose of collecting whatever documents, if we can get things from, you know, places like Redwood Quality, whatever that we can bring towards our commission so we can ultimately get it to the Board of Supervisors. I'd like to put it on the agenda for next month to have a presentation of what Howard Hospital legacy, the old Howard Hospital has, and what paperwork has been prepared so that we can all go into this with our eyes wide open. Jan, I'd like for you to be on the committee, ad hoc. Is there anybody else who would like to be on this 3-person ad hoc for the collection of this and to make a presentation next month?
Could you say a little bit more about what?
Well, what this 3-person ad hoc is going to be is to hopefully be able to collect all the paperwork and preparation that the foundation, that Redwood Quality, and what the county have done to look at Old Howard Hospital, and to combine it so that we can have it in a presentation for us all to look at and for the public to see it. There's certainly going to be people who are not in favor of this from the public, maybe on this commission, I don't know, but they need to have as much information as we have. And we need to hear what they have to say. So I'd like for Jan to be on it. Are there any 2 people? So Carmel and Janine would like to. Is there anybody else before I choose who it's going to be? Is there a 4th person who wants to be on it? All right, so we'll have Janine Miller, Dan McGordy, and Carmel Angelo. But I want to make sure that you know what this is for. It's for next month's agenda to have an agenda item which is going to be the presentation of Old Howard Hospital possibilities, location, concerns, cost estimates, any information that we can get that we can bring towards this commission is what we need.
I lost you. I thought that we were just going to compile the types of facilities and not specifically a
Well,
place.
this ad hoc is to deal with everything that's been done on Old Howard Hospital. Because that's very important. But if we don't talk about Howard Hospital now, we're always going to avoid talking about it. Because it seems to be the one subject that people around the county talk about when we talk about a mental health facility. And they say, what about Old Howard Hospital? So I think that we as a commission need to make a fair recommendation to the board of what our thoughts are. Is it reasonable? Is it not reasonable? Is it feasible? Is it not feasible? So, Jan, with that, do you still want to be on the ad hoc?
Yeah, we're going to collect information that's already been done, correct?
Yes.
In
That's
addition
it.
to finding, the option.
So that everybody
This
has
is
a level
relevant to
playing
the
field.
hospital.
Right.
What's that?
This is relevant to the hospital ad hoc committee. I was
Yes.
gonna add something. So, with this vision that's placed on this plan, is this going to continue to be a hospital in the state's eyes? Is OSHPD going to have jurisdiction over this? So
No,
the
OSHPD
premises doesn't keep the OSHPD designation, it's
No.
the use?
No, it's not a hospital.
It's not a hospital.
Well, I mean, it's not an acute hospital.
Okay.
So an acute hospital is different from a psychiatric.
Because from a financial standpoint, that really makes a big difference when you do renovation.
designation.
Well, that's a
keep it as a hospital.
Huge
Yes.
cost implication.
So those
No,
are different
that's-
categories.
Wait, stop. We have 6 people talking.
Good job, Chair.
All right. Hold on 1 second. Janine, did you have something to add? Okay. Is there, Jed, you had your hand up a minute ago and I said I'd write that to you. Do you have anything, was that comment with this?
Yeah, I think this is probably included in what the charge to the ad hoc committee, but I would like to see, in addition to the focus on Howard, that we understand these various designations that might be needed, whether Howard necessarily, I just don't know enough, but some of the things that Ace was saying about these various kinds of facilities, I would hope that would be included in what you'd be looking at and would present back to the...
I think that's what Jen was referring to.
Yeah, okay, I assume that, I just wanted to be sure.
So Jan talked about 3 different topics. She talked about options, you talked about facilities, and you talked about staffing. And I think that those are all three very big topics to discuss
Well,
for,
no, I was thinking facility options was one
I
topic,
see, okay, all
which
right.
is what I'm assuming this ad hoc committee is.
Well, this is for the most part dealing with the most common facility discussed, and that's Howard Hospital.
But that's a place.
That's a place.
So there's a place, but then there's also what kind of a, infrastructure is in that place, which is.
I understand, but I think that, and that's something that we as a commission can talk about, but the Howard Hospital is such a big topic to talk about. I can't imagine us spreading this ad hoc so thin that you're doing everything. We really and truly need to collect everything on Old Howard Hospital so we can make a recommendation to this board. Either we recommend or we don't, and let the board.
Right, but I mean, my understanding is in the information regarding Howard Hospital, all of these other details were discussed and need to be, compiled.
It's a big task.
Right.
3 smart people are on ad hoc, so, okay.
Good say.
Hey, Tom,
All right.
what's your suggested name for the ad hoc? Do we want to specialize a name?
The facility ad hoc.
Okay.
So it'll be the facility ad hoc.
Okay.
So, yes, Margie.
The OSHPD requirements were taken into consideration by the person that did the project that you're looking at.
Will we be using public dollars, or will we be using, are you guys spending this money and we're renting it, or are we spending
We
this
don't
money?
know that. That's something that the
Is that-
supervisors have to
that's-
decide.
Yeah.
Can I just make a comment?
Yeah, sure.
So, very good question, and there is no answer on that, and probably it would be good for this committee to make a recommendation. But what I can tell you, what we were thinking of in the past was, we weren't certain at that point whether the foundation was planning on selling or leasing. We talked about both options. At that time, we did not think we certainly had the money to purchase the building. I don't know if we would have that today. But I think the biggest option is, or decision really is, whoever provides that service, if they're going to be a contractor of the county, does it make sense for the county to own or lease the building? Or does it make sense for the contractor who's actually running the service to own or lease? So I would like to say, to answer your question, there are more questions than decisions on this one. Because if we have fiscal conservatives on this commission, then we're gonna have to have some big answers before that decision can be made as far as a recommendation to the board. So there's a lot there.
Well, my specialty here is public contracting, and I know the costs that are involved in private contracting and public contracting. And I know what working for the hospital is, as I'm working for the Mendocino Coast District Hospital right now. So, from my standpoint on being on this board, the cost issue and how to spend the money of the people properly, I think that's where I could, or not properly, but conservatively, I bring a lot of benefit. So if we could have private dollars funding these repairs, it would go a lot further than using public dollars.
So they're not,
Prevailing wages.
prevailing wage.
Yeah.
That's very interesting, isn't it?
No, actually, there's some prohibitions on that of, we can't go into this telling a private corporation, and county council can, you're not our county council, but you can still yell at me right now if you want. You can't go in here with a wink and a nod and say, private company, will you build this, and ultimately, we're gonna buy it or lease it for the purpose of public good. There's some prohibitions. And so, and if Margie doesn't mind me saying, in the paperwork that she has from the contractor who for $48,000 did the consultation, the reason that the offer came in between 11 and $14 million, a $3 million variance, is because of $14 million would be if it was used prevailing wage, and $11 million being used if it was a private entity. Is that correct, Margie? Okay. So with that, and Jan, I appreciate you bringing that up. In everybody's packet today is an email from Anderson Valley resident Mark Scarmell. And it's a very well-worded email that discusses, Mr. Scarmell obviously did some homework and researched questions that this board has itself regarding what kind of facilities we have and so forth. And I would really encourage all three ad hoc members to read the email and to look at what his research has done. He brought up some points, honestly, that I hadn't thought about. And I thought I had thought about everything with mental health in this county, but Mr. Scarmell will put some thought into this. So if you could please look at this, and then the other commission meetings, you also have copies of this. Is there any more public comment on the, well, we got stuck on 3B there. We're going to go for, okay, we have an hour and 10 minutes left. We're going to go as quick as we can. We're going to talk about mission statements. And I know Jed talked a little bit about it. Ross had a mission statement. A mission statement, just to make sure everybody understands, a very short statement so we can all understand what our mission is. Where are we going? And Ross, is there anything you'd like to add to this?
Yeah, so I kind of came up with one here. I get my phone to the mission of the Mental Health Treatment Act Citizens Oversight Committee is to ensure the effective, efficient, and transparent use of those funds provided for by the ordinance for the benefit of the community. That was sort of one variation. I batted it a little bit with some friends. And the mission of the Mental Health Treatment Act Citizens Oversight Committee, that's a mouthful, is to ensure the effective, efficient, and transparent use of those funds provided and as defined by the ordinance for the benefit of the community. That's kind of what I...
Anybody else want to weigh in on mission statement? Yes. Oh, I'm sorry.
Go ahead. She's first. I was just going to say it's right there in your specific purpose. We are committed to improving residents' lives and the public safety by strategically evaluating and enhancing resources for mental health treatment. It's right there in your measure.
I agree with that. That's, yeah, what I was gonna say. I don't personally see the need for a mission statement in this context because it is so clearly outlined in the ordinance there and under specific purposes, sections A and B tell exactly what this commission is supposed to do. If the group wants to massage that in a way that makes it sound better or whatever, as long as it's consistent with those, I'm fine with it. But I personally don't see a need for a separate mission statement for this committee.
Okay, so what's being discussed on 5.180.040, capital letter B, let me read what the voters passed. Provide for assistance in the diagnosis, treatment, and recovery for mental illness and addiction by developing a psychiatric facility and other behavioral health facilities. And number 2, a regional behavioral health training facility to be used by behavioral health professionals, public safety, and other first responders. So that's what you talked about?
No, I'm saying just use it straight here. We are committed to improving the very first paragraph, when it says what we are, specific purpose. We are committed to improving residents' lives and the public safety by strategically evaluating and enhancing resources for mental health treatment. It's all right there in one sentence. And that's our purpose.
Say again what the
So
number is?
Under 5.180.040, specific purpose on page 1.
Okay, got it.
So the very first sentence, Mendocino County is committed to improving residents' lives for the public safety by strategically evaluating and enhancing resources for mental health treatment, period.
Except it wouldn't say mental health county, it would say our oversight. Simple, straight, to the point.
Anybody want to weigh in? Can we move on? Yes, Jan?
I just think we should insert the word all residents because so often we're only talking about people on Medi-Cal or Medicare or whatever it is.
So another resident, instead of residents, put all people.
All residents.
All residents.
And our purpose is to advise the Board of Supervisors to,
Right. You're right. Our purpose is to give wisdom and advice to the board so they can do what Donna just stated. right?
Yeah, exactly. I forget that we're advisory. Sorry.
Carmel?
Yeah, and I just, I said this at the last meeting, I just want us to be careful because we're not the Mental Health Advisory Board. And they have a much bigger role in mental health than this committee does. So I just want us to be very careful that we don't create something in writing that confuses people. We're not the Mental Health or the Behavioral Health Advisory Board.
Okay. Yes, Ross?
So I like what you're saying, that you're grabbing it out of here, but so our purpose is to make sure that the money's spent carefully and wisely, I think, and to accomplish this goal, right? But I think we're tasked as the Oversight Committee with like a specific function in that. It's a little different. It's a little bit different
I
than actually
understand,
it's a little different than the goal of the
Right.
ordinance. Our task is is a portion of that. That's my thought. And that's the way I saw my role here, is to kind of try to ensure effectiveness and efficiency in it.
Well, actually, big letter D tells what our purpose is. So that was letter A. If we go down to letter D, it describes who we are and what our purpose is. And we do the annual audit, we do the physical recommendations, and we send the recommendations to the board of supervisors. Maybe as Mark said earlier today,
Right.
we all came here with our own perspective in our little world of what we do. And we're all kind of good in our own little world of what we do. And I don't know if we should spend too much time talking about a mission statement for the purpose of overriding, as Ross said, what the voters have said, what we're going to do. If somebody doesn't understand what our mission is, honestly, I don't know if they should be on the board and tell us you don't understand. And we'll either spend a lot of time explaining to you, or we'll see if this is really the right place for you to be. Because our mission is very clear: to improve the quality of life for mental health patients in Mendocino County, their families, and their neighbors, and our communities. And to provide treatment facilities of which we have seen in our county for over 20 years. Almost 20 years.
I think a mission that encompasses all of that is important, really. And I think it should be a one-sentence thing, and I like what he said in his second, what he said in writing, because it encompasses Measure B, which is saying everything that you guys are saying. But it also says that we're going to do it in a transparent way, we're going to do it in a cost-effective way, and it's how we're going to look at implementing Measure B. So I really did like what he had to say, and I liked what, I'm sorry.
Donna.
Sorry, Donna.
It's okay.
Yeah. Had to say too, but I think Donna's was a little more specific and his was a little broader. And the mission, you want the mission to be broader. That's my personal opinion.
Okay. Nobody wants to spend a whole lot of time of our precious 2 hours on mission statements. I'm going to do this. I'm going to ask the clerk to put it on the agenda one more time for next month. If anybody on this commission or any citizen would like to submit a mission statement to the clerk, it'll be in next month's agenda, and we'll merely discuss it real quickly and do a vote on it, because we have some other things we can move on to. But I'm not downplaying a mission statement. I guess I'm just too type A. Instead of talking about a mission statement, I want to get on the horse and ride it, and let's get closer to the goal. All right, we're going to move on. Is there any public comment on mission statements? Thank you. All right. We are going now to go to item 3C, the committee's advisory role to the Board of Supervisors, which we've somewhat discussed. Is there any public comment on the committee's advisory role to the Board of Supervisors, discussion and possible action regarding the committee, how the committee will present advisory items, requests, and/or reports to the Board of Supervisors? Any public comment? Okay. This is one part of our commission which we haven't talked about. How are we going to make our official recommendations to the Mendocino County Board of Supervisors for their expenditure of dollars? And as Lloyd has said, and he's a county auditor, has said, we are able to expend our monies once they're starting to be collected in that fiscal year, so April, May, June, 3 months worth of our monies, if we believe that there is a need to expend that money, whether it's for a needs assessment or what. But we have to get in line to where, how are we going to make the recommendation to the Board of Supervisors to get on their agenda? Well, number one, to come up with what the recommendation is, and then to get on their agenda, and then for the proper presentation to the Board of Supervisors. That hand up? I'm sorry, he did that.
I understood that we don't have to wait for the money to actually be in the treasury in order to commit it. Is that right?
Well, you're going to have to bring a budget forward to the board that shows funding sources that will cover it. You know, we can't approve anything that's not funded, so cash-wise, is the cash going to be on hand by the time the expenditure is made? So as long as that happens, we can submit a budget and proceed with an approved budget.
Jan?
That's news. Okay, so what I was thinking is we need to know how to get on the agenda, right? We need to know how to get on the supervisor agenda. How much time does that take? And then we need something written to submit to them, and the budget thing is evidently something that should be included. So that's easy.
Yeah, and certainly Janine and I would have an idea of how to get things on the agenda. We, 3 weeks in advance to get it to the CEO's office, to the clerk of the board's office, for the chair of the board to review it and to accept it on the agenda. But for us to be at least with majority support of whatever goes on the agenda. And that's, it's an 11-person commission. So it's important that we know what's going in front of the board, and we're prepared to back it up with the wisdom that we have here collectively.
And it needs to be in writing.
It needs to be in writing, absolutely. Yeah. Just done it.
Isn't there a policy and procedure for that, Janine, for reporting, or Ms. Angelo, to the Board of Supervisors? Could we get a copy of that?
Yeah, you can. The sheriff actually was right on though with, we can get you that, and actually I would request that Dora just work with my clerk staff, and we'll do it that way.
Just so that all of us know?
Sure, yeah, please.
So what we'll do is, Dora,
Yes.
for next month's agenda, which is passed out, could you please include a copy of the clerk of the board's policy on putting items on the Board of Supervisors agenda?
Yes, I can.
Isn't it outlined in the Board of Supervisors procedures?
It's not exactly. It is for their agenda, but it's not for someone to,
Those rules of procedure speak to the meeting.
Right.
They're not to all the aspects of the meeting.
I'll include their calendar as well.
Right. Yeah, and it is a 3-week. Sometimes I've been allowed to get in there in 2 weeks in advance.
If you know the right person.
If you know the right people, but that's an exception rather than the rule. Government is not going to win any fast foot race. All right, any more discussion on the request of the agenda items for the board? All right, next item, committee rules for procedure, discussion, and possible action on adopting the Board of Supervisors rules of procedure for the committee, with a possibility of the committee establishing their own rules of procedure for the future. Dora has included the rules of procedure by the Board of Supervisors in everybody's packet. It's from January 2017. It's 14 months old, but it's still, I've reviewed it, it's still pretty accurate as it is. Is anybody having questions about this? Donna?
I think a lot of it applies, a lot of it doesn't. I think it's very good. And I'm going to throw my foot out there and say 2 or 3 of us could revamp these really quick and have them to the county clerk before March 12th to adapt to our specific issues.
So another ad hoc committee.
Yeah, 2 or 3 of us, easy.
Committees of one work pretty good too, I want you to know this.
Easy peasy pudding pie, yes, but I can't email it out to all of you
No,
to
you can't.
do
You
anything
can't.
with, so. See, I know, and I didn't take the training yet.
All right, so this is just a 1-month thing. Is there anybody who would like to work with Donna on the rules of procedures strictly
weeks.
for this commission?
Oh, come on, guys.
Nobody likes me.
No, we all love you. Oh. Okay.
It's really easy. I'll email it to whoever
Yeah.
would like to.
Shannon says yes.
You can send it to me too.
Shannon and Mark.
Great.
Okay. So that is going to be just a one-time meeting, 1 month meeting. You guys can meet more than one time, but, oh wait, we have a lawyer weighing in.
Just a comment, so make sure you do it as a red line, so everybody knows what.
Right, and I'll redline it. No, I redline it. I greenline what I've added. Yellow, got it. Perfect.
Red,
Thank you.
green, and yellow. I'm a
Yep,
cop.
you
I know what you're
betcha.
talking about. Stoplight. Okay. That's just a 1 month committee. We're not going to have the death of committees here. All right. Now we're going to get into a presentation with committee member Janine Miller. Mental health director will present an overview of mental health services currently in Mendocino County. And this overview is designed to give committee members and the public a basic understanding of how mental health services are currently working in this county. Janine, it's yours.
He's full screen. Yes. All right, so this is a quick overview, just a kind of an agenda of what I'm going to go through, sort of who do we serve, Medi-Cal versus private insurance, a little bit about the County Health and Human Services Agency Behavioral Health and Recovery Service branch, how we serve individuals through our administrative service organization, a quick overview of facilities. I will not be going into a lot of facilities because that's probably an hour presentation all on its own, but I'll give you a brief overview of facilities. So when we look at mental health services, we sort of look at it in this perspective. What are the different insurances we have? Within Mendocino County, 45% of the Mendocino County residents have Medi-Cal, 35% have a private insurance, and about 20% have Medicare or Veterans Insurance. So then we're going to go into what are specialty mental health services. The California Department of Healthcare Services administers a managed mental health care plan for Medi-Cal eligible beneficiaries. The California Department of Healthcare Services contracts with Mendocino County to operate a mental health plan for specialty mental health services. So this just gives you a quick overview of Department of Healthcare Services. It's a large branch with the state of California. There's a small piece, as you'll see, called Special Mental Health Services that are carved out from all of Medi-Cal services. These are administered by your local county. And so that's that special piece that we're going to talk about today is Special Mental Health Services. So what does Special Mental Health Services cover? So right in front of you is a list of everything that we can provide through Special Mental Health Services. But what I want to say that's really important with Special Mental Health Services is that you have to meet criteria for Special Mental Health Services. And I think that's where some people get a little bit lost when they talk about mental health services that the county provides versus mental health services that are provided throughout the county. Especially mental health services, the individual has to have a diagnosis that's within the Title IX diagnoses that are acceptable for special mental health services. You have to have a functional impairment that can be treated by a mental health specialist, and it can't be due to a medical issue. If you don't meet criteria, then you can't be treated under special mental health services. The big piece with special mental health services that the county provides, and I'm speaking from what the county provides, is that you have to have a serious mental illness. The county is not contracted to provide services to anyone that would be classified as mild to moderate. We only provide services, and we're contracted with the state to only provide services for special mental health to those that are seriously mentally ill. Medi-Cal contracts with your federally qualified clinics to provide services for those that are mild to moderate. They also have an administrative service organization, which is like a third party is how they call it, that is called Beacon, that provides provides mental health services to the mild to moderate, and they contract with individual clinicians, therapists in the community. So you have that option within your community. If you don't meet serious mental illness criteria, you can be served through the mild to moderate, through Beacon, or one of your federally qualified health clinics. Obviously, we know the Veterans Services also has their own mental health services locally. So kind of just a quick overview of those services. We provide assessment, client plan, rehabilitation services, therapy, case management, medication management, therapeutic behavioral services, intensive home-based services, intensive care coordination, day treatment, crisis intervention, crisis stabilization, crisis residential treatment, acute inpatient hospitalization, psychiatric health facility, inpatient hospitalization, adult residential treatment services, mental health rehab center services, and Institute for Mental Disease services. If we don't have these services currently within our community, we do have to contract and provide them outside the community. As you've heard, some of the members state that some of our clients are served outside of Mendocino County. Those are usually our individuals that are on an LPS conservatorship, and they're placed within a facility and get those services outside of the county. Children, day treatment is generally, we see more provided in children's, and those are usually in group home facilities for 17 and under. What is not covered? So this is a very interesting thing as we talk about facilities. It's really important to know how our facilities affected when it comes to Medi-Cal. So there is a lovely federal regulation that says there is a thing called an Institute for Mental Disease exclusion. It excludes most patients in mental health and substance use disorder from being in a treatment facility larger than 16 beds and getting that facility paid for. So the reg actually says that if a facility provides services to a special population, such as mental health or substance use, and it has larger than 16 beds, we cannot bill Medi-Cal for those services. There is an interesting thing, if you're 65 and older, it doesn't matter. You can be in any size facility and we can bill Medi-Cal for you. If you're a youth that's 21 and under, we can bill Medi-Cal if you're in inpatient psych hospital services. But besides that, all other facilities are excluded once they become larger than 16 beds. And what happens in those cases is that the county can no longer bill Medi-Cal, so we have to pay straight out of realignment dollars. There is no insurance reimbursement for those facilities once you hit over that 16-bed max. This gives you a brief overview of just behavioral health and recovery services. You can see kind of where we fall. You see we fall under Health and Human Service Agency. There are 3 branches within Health and Human Service Agency, that Behavioral Health and Recovery Services 1, and then we have our Social Services branch and our Public Health branch. Oops. So this gives you kind of an overview of behavioral health. There's always that question on how much money is there in mental health, what does that look like? So you'll see that the average budget for mental health is about $23 million. The revenue for Mental Health Services Act this year, our revenue is $4.5 million, and our budget for substance use disorders treatment is $2.4 million. What I want to say really quick about this mental health budget, and this would be an hour presentation just on finances for mental health because it gets really deep and into the weeds, but I'm going to hopefully broadly explain it and it'll make some sense. When we do a budget for mental health, it's an estimate budget because we have to bill for our services to get the budget we want. So even though we're saying we're estimating our budget at $23 million, we also put into our budget that $8 million of those dollars is going to come from us providing services, billing the state for those services, and getting reimbursed for those services. If we don't do the services or Medi-Cal decides that we didn't meet criteria that they felt we needed to meet, they won't reimburse us for those things. So they can come in at any time and say, you did the service, we don't agree with that the client met medical necessity, we don't agree with the way you wrote your progress note, etc., and they decide to disallow a service. So when you look at mental health budget, just remember, while we're saying it's an estimate of $23 million, About 8 million of that is as long as we provide those services and we bill and we don't get any disallowances from the Department of Healthcare Services. So really looking at, so what are the mental health, how are mental health services delivered? So the county provides a number of services, a small number of services, and then we have some contracts. As you know, the majority of our services are contracted with the Administrative Service Organization, Redwood Quality Management Company. We began kind of competitive bids to outsource services in 2013 because there was dissatisfaction with services by our residents weren't happy with our services. We initially contracted, as most will know, we had an adult service provider and a children and youth service provider. And just really quick to sometimes ask, what does the county still sort of oversee? Two of the big programs that I will just say really quick that the county runs is the Mobile Outreach and Prevention Services, which is a co-program with the Sheriff's Office. It's a mental health rehab specialist and a sheriff technician that go out in our outlying areas and work with individuals in that area. And then assisted outpatient treatment, which as a lot of people know is a Laura's Law program. So Redwood Quality Management Company is our current administrative service organization. They have two service contracts with the county. One is for youth up to age 24, and then they have an adult contract for 25 and over. They are providing the majority of all of what you would see as your outpatient services and your crisis services. So that's a good way. As you saw all of those services that we listed, these are all the services that we can offer in special mental health, and 99% of them we do offer. Our QMC is providing those services. They contract with our local service providers to provide those services. This is the list of the current specialty mental health providers in Mendocino County. You have Manzanita Services, McCavan, Mendocino Coast Hospitality Center, the Mendocino County BHRS, which I talked about two of those programs, which is the county, Mendocino County Youth Project, Redwood Creek, Redwood Community Services, Redwood Quality Management Company, and Tapestry Family Services. And I'm going to point out really quick, you're going to see Redwood Creek in there. And I'll talk a little bit more about that when we get there. They are our only treatment facility that we would talk about as when we look at the facilities list. That's why they're on that list. They provide a facility for us up in Willits. The other part of specialty mental health that we talk about is the Mental Health Services Act. And that is, those that don't know, it was Prop 63. It was the state tax that was implemented in about 2004. And there's a 1% tax that goes on to anyone who makes more than $1 million a year. It was implemented to expand and enhance and bring new mental health services to the communities. There are 5 categories really that you'll see within MHSA, there's a CSS, which is a Community Services and Support Program, Capital Facilities, Needs Piece, Workforce Education Training, Prevention and Early Intervention, and Innovative Programs. The 3 main ones that you're going to see with MHSA, as we see the Capital Facilities ends June of this year, and Workforce and Education Training ends June of this year. They will no longer be funding those programs. And so we will keep the CSS piece, the PEI, and the innovation programs. And those will be are in the 3-year plan and will continue to be. So these are MHSA service providers. They provide the Mental Health Services Act services throughout our community. They bring different pieces to what they provide, and I'm not going to read them all, but you can kind of see who they are, and I can always provide more information on what they provide if that's necessary. So here's the types of mental health facilities. You'll see that I starred the one that's currently available in Mendocino County. And that is an adult residential treatment facility. That is the Redwood Creek facility in Willits. They are the only what you would call mental health facility, if you're looking at treatment of an inpatient type within Mendocino County currently. They have 16 beds. They can bill Medi-Cal should they choose to. They don't always choose to. But the other options are a boarding care. These are usually specialized boarding cares. They usually serve mental health clients. That's their specialty. Crisis residential treatment, crisis stabilization units, Institute for Mental Diseases, mental health rehab centers, psychiatric health facilities, psychiatric hospital, and a specialized treatment programs in skilled nursing facilities. The last one is a special program that you will usually see that's embedded within an Institute for Mental Disease or a mental health rehab center, and that's because they focus on the elderly. So they have a skilled nursing piece within their facility that really focuses on that elder population. It also allows you to have the Medicare, Medi-Cal billing that goes into it because they're a skilled nursing facility. But all of those up there are, impacted by the IMD exclusion. So if any of those facilities have over 16 beds, we then go back to that IMD exclusion. As Camille was saying earlier, there is maybe one that I know of, mental health rehab center that bills Medi-Cal. I hear there might be a second one, but the mental health rehab centers is really rare to find any that are 16 beds or less and bill Medi-Cal. It's kind of a newer thing that's happening throughout the mental health field to have more options for that. Most boarding cares do not bill Medi-Cal and don't have those options. So this is just really quick that, as you guys know, we have a Behavioral Health Advisory Board and we have the National Alliance on Mental Illness, Mendocino, and they offer additional advocacy and support to those affected by mental illness. We also have a North Bay Suicide Hotline for Mendocino County, and that was our, that number's down there listed. We have a crisis line that's listed and an access line that are both 24/7. All of those lines are 24/7. They can all tell you what our services are, how to access them. They're really good at getting you connected to services. The suicide hotline is something that we enacted a few years ago. We've always had a hotline, but we actually brought it in and had another company running it, and they know our whole county, which is amazing. They can link you to anybody, and it's a really neat program that they've designed to really be a suicide hotline for Mendocino County. And that is it.
Wow, that was great. That was supposed to be 30 minutes, and that was 15.
I tried to talk fast, I knew we were running behind.
Thank you very much.
Are you gonna have a test?
Well done.
All right, someone can grab the lights there.
Oh, sorry.
Thank you for a great presentation. Any public comment about that great presentation? It was great, even though it was short, it was great. I'm not just saying it was great because it was short. It was great. Any commissioners like to comment on that presentation? I would encourage you, and the Brown Act would allow this, certainly if you have questions about what mental health services are available, contact Janine or a member of the Behavioral Health Board to discuss this, because if we're going to give a roadmap for this county for the next 50 years of brick and mortar of facilities, we certainly need to have a very good understanding of what we have now. Jed?
And just a quick question, do you know offhand, or could you get the amount of money that's being spent to send people out of county? You mentioned that, but I've never known exactly how much we're spending.
I don't have the exact figure. So I don't want to quote an exact figure. You have to remember that there's two types of 24-hour care. You have your acute care, which is going to be your inpatient psych hospital, and that's going to be one cost, and then you have your conservatorship cost. I can tell you we have approximately, I think, 54 individuals conserved, and you can, and then a portion of those are out of county. The boarding care cost ranges. I guess the best way to look at it is that the way boarding care works, so this can kind of give you a little bit, is that, as you know, we can't bill Medi-Cal for 99% of them. So they take the person's SSI, and then the county has to pay a daily patch. The daily patch depends on the facility and the level of care. The basic, I would say it starts at about $90 a day. It can go up to $800 a day per person. So that's how you look. If you're going to look at conservatorship and stuff, that's what you're looking at. Anywhere from $90 a day for each person you've conserved, up to $800 a day that the county pays on a daily patch when we conserve people out of county, when someone's conserved and we have to place them.
I was just thinking in terms of what we're looking at and what the committee's going to be doing, just getting some idea of how much is being spent for the kinds of services that we hope to provide locally, to get some comparison of what we're already spending, so that we can see what we'd be saving if we have things local.
So if the chair would like, I can bring that back.
That'd be great. Yeah, thank you.
Super, thanks.
And I've certainly wondered that the whole time. Well, one second. Any other commissioners have questions on this? Is there any public comment on this? Please state your name.
Josephine Silva. I have a question as to whether or not you can have two 16-bed facilities sort of serving different aspects of what you've described in the same building, so to speak, but separated.
So we welcome public comment, and during a meeting, we don't respond to public comment. I think she heard what you said, and I would imagine this meeting is going to be over soon, and I would encourage you to stick around, don't leave, and you can get the answer to that, okay?
Thanks.
Any other public comment? All right, moving on to the Kemper report. Now, remember what we talked about the Kemper report. The Kemper report was done at a point where Mendocino County was having a very, this isn't opinionated, this is fact, a very frustrating time with a mental health private provider. And we had an outside third party come in and to look at what services were being provided, how they were being provided, and recommendations of where to move forward. And the Lee Kemper and Associate report came out of Napa. I believe he's out of Napa. And he worked with the Board of Supervisors. One amazing thing about this report was he was contracted for a certain amount, and his final bill to the county was about $10,000 less than what his contract was for. In government, you can really appreciate that. That's like having a short meeting, okay? You can really appreciate that. When somebody bills for less than what their contract's for. And there's a discussion about the needs assessment of what, as Mark talked about and what Jed talked about, of do we need a needs assessment do we need to recommend to the Board of Supervisors a needs assessment for mental health, brick and mortar facilities and services of the $1.7 million a year that this commission is charged with making recommendations of. And last month we had a spirited discussion on if we need a needs assessment, and I would imagine each committee member's had a chance to think it over. Is there anybody who would like to discuss this? A needs assessment for mental health service buildings in this county. Shannon.
I think Jan had her hand up first, sorry.
Are we just skipping over the Kemper report then to talk about that?
No, the Kemper report is exactly that. That's what we're talking about. We're talking about.
Okay,
those two can be combined. I'm sorry. So 3F and 3G can be combined.
In the Kemper report, in the executive summary, where they identified the 6 areas that are affected, I think that would directly be important to this particular committee is the lack of in-county residential care and crisis residential services, which is why we had Measure B. The defined structure for coordination and incomplete interface with these other issues. So, seen as I think that is still a problem, all of these 6 areas, I think that's the purpose of a needs assessment. And in addition, the Stepping Up initiative that the county had mandated participation in 2015 that's never been continued, one of the really important aspects of that was to have a system analysis and overview to see where the holes were, where the duplications were, to try to make a complete system that's efficient.
Well, efficiency is certainly something that we want. You know, we have people like Ross Liberty on the committee to whip us if we don't talk about efficiency. So
I
wouldn't say that exactly.
I would.
I'm thinking that the Kemper report would definitely advocate the need for a needs assessment.
All right, anybody else like to weigh in? Carmel?
Yeah, I just want to say that, you know, the Kemper report was a different time, you know, it was a totally different time, different place. For those of you that were here, as we know, and also have read it, though some of the things in here are really good and still pertinent today as far as public accountability. And then, of course, the list of recommendations. I personally don't think that the Kemper report is the needs assessment, and I know the question is, do we need a needs assessment? I don't see this as being any type of substitute or beginning of a needs assessment, because our system is entirely different today. We still have gaps, but it's entirely different.
So let me just ask the question, and are you saying that you believe we need a needs assessment?
You know, I would like to say yes or no to your question. Where I am with this is, anybody who knows anything about mental health in this county knows that there are specific services that we don't provide. And we know a 24-hour facility is one of them. So I think there's a part of me that thinks to do a whole needs assessment to come back and say we need a 24-hour facility could be a waste of time and money. At the same time, you know, the public health person in me says, well, you know, we should do a needs assessment before we move forward and spend $30 million. So if I had to vote on this right now today, I'd say yes, we should do a needs assessment.
Well, it's on the agenda, we possibly could talk about it, you know, make a recommendation to the board. Shannon?
I guess I feel like I need to understand more what information we have. I feel like we've been providing mental health services for decades now, or our contractors have, and that this information should be mostly available. And so, I'd like to understand how much of the information that we would be asking for in a needs assessment might already be available to us with our partners. And then B, and I had a B, I guess on this parallel path is an ad hoc working towards a specific facility. That there seems to be a significant amount of consensus that is needed. And so are those two things in conflict? Is it cart before the horse?
Or are they two horses side by side, you know,
Right.
that could be. So, Doctor?
I just would like to concur, I'd like to agree with Shannon. I think, and that's the way I'd like to see it happen. I think a needs assessment is fine, I just would not like to see it delay what we're doing.
Well, I can tell you that based on what Lee Kemper and Associates did last time of not billing the county at the highest rate possible with a contract, would lead me to make a hope that somebody on this board could make a motion that we recommend to the Board of Supervisors that we go out for a needs assessment, and if this information is there, and if some of it has already been collected, then we're not going to be billed for it. You know, I don't know of any one county employee who says, gosh, I have the time and the knowledge to do a needs assessment of everything that we need in Mendocino County for mental health brick and mortar. As the director of mental health, do we have that person? I don't think we do. And time is of the essence. With Lloyd stating that we could pay for, you know, and I believe that the payment would be between $20,000 and $30,000, maybe less, for a needs assessment, for us to have genuine black and white direction of what we need, and realize that we are planning for the next 50 years of mental health services in Mendocino County. And we have to look at what the population growth of the state is and population growth of Mendocino County. Let's hope it grows a little bit. And what our needs are going to be in 15, 30, and 45 years from now. Jed?
Yeah, I agree with a number of people that have spoken, and I may well agree that we need a needs assessment, but I'm for finding out what we already know now, because there's a lot of expertise. We've heard a lot of it today, but I think we've honed in on, we know what our mission is. It involves, you know, an inpatient facility. I'd like to hear what the committee that's going to report back next week has to say. Month, yeah, I'm sorry, next month, yeah.
Next week.
Not, 1 month is soon enough, I get that. And then if once we know from what we already have, what we've already learned, then if we need a needs assessment, I think we can specify in much more detail what it is we want any contractor, whether it's Kemper or anybody else, to answer for us. You know, I think we know what questions we might want to know, or if not, I think we should. We ought to know what we want anybody to do if we're going to ask them to assess. So I'm just saying, let's find out what we have first and then see what we need, and if we do, let's ask for it.
I have a procedural question that we discussed last month.
Wait, you're gonna speak louder.
I'm sorry. I have a procedural question that we talked about last month, and that is the possible need for an RFP before we can hire somebody to do a needs assessment, and I
Well,
think
what we would do is we would make the recommendation to the Board of Supervisors, and they would do the RFP.
Okay.
So we're just doing the recommendation.
Okay.
And I want it to certainly be known, if you haven't had a chance to read Sonia Nesh's letter to the editor regarding the 4 things that we need in this county, it was a well-written letter. It was something, as Jed says, you know, we know what we need, but we may not know what we don't know. And there's things out there that could be beneficial to us that somebody could. And while some people are saying $20,000 or $25,000 is a huge amount of money, and it is, I'm not going to belabor that, but when we're talking about $32 million of money to be spent for brick and mortar, my opinion is we need to start off on the right step to say, this is what a genuine professional has said after looking at everything, after looking at our past reports, after looking at the statistics of how many people a day are sent out of county to out of county facilities, and you know how much money we're spending and so forth, and what the staffing is. There's some major needs here. So is anybody ready to make a recommendation to the Board of Supervisors that we proceed with a needs assessment and work with the Board of Supervisors? We can work with the Board of Supervisors on the basic language, but if we're going to get into the minutia of us writing an RFP, I can guarantee us we will never come to a satisfactory conclusion. We will walk away frustrated. Russ.
So, you know, potentially, I'm not sure that it would be so bad for us to kind of come up with some bullet points, things that we want to know. And frankly, it seems to me that the Kemper report is going to mostly ping the people in this room anyways. Certainly not me, but they're going to ping a lot of the experts in this room anyways. And maybe once we start sort of formulating some of the questions we'd like answered, and we are going to want Kemper to answer certain questions, or whoever, right? We're going to want we're going to want to understand certain things. We're going to want certain questions answered. If we start formulating those questions, we may well come to our own conclusions. Always like, you know, we might go, well, the answer to this one is obvious. We're asking these questions, and we're asking them to answer these questions. And we say, you know what, we don't really need.
So let me ask.
And it might be faster.
Let me ask Janine Miller a question. Janine, other than you, would you be able to? I don't need to name a name if it's going to I don't want to throw anybody on the bus. But other than you, do you think there's a person in Mendocino County who knows everything there is about mental health, of brick and mortar, of our services, that would be able to dedicate a couple? Now, I'm trying to get the cart before the horse, but instead of us spending $25,000 on an outside consultant, what if there was a county employee that said, for 2 weeks, I am going to answer the questions that we're talking about and get the answers? Is there a person like that?
That knows it off the top of their head?
No, but that could research it the same way that Lee Kemper would research it.
Sure, somebody could research that. Would they know it to the level we would hope that they would know it? No. We would be pulling someone in saying, go research this and learn it, and then come back and tell us what you've learned. So if you're saying besides me, no. That's someone who knows probably the majority of it, no. We would be asking them to research it and learn. One of the things we don't have is we have what we can read within what are the state requirements, what are the community care licensing board requirements, what are the staffing requirements, because those all play into every facility. And then you have what are Department of Health Care Services requirements for making it Medi-Cal billable. So you have different agencies you have to look at, and then they have their different requirements. But what we wouldn't have is, what are other counties doing? What are they finding that's the best for their community? So are they saying a PUF is better than a crisis stabilization? Are they saying crisis stabilization has cut hospitalizations by 50%, that you don't need a PUF? There's so much more bigger that we wouldn't know statistically what other counties are doing and what's been beneficial for those counties. Because there are other counties that have been bringing things in. And so that would be a lot more research, and somebody that's an expert may know that.
Okay, but Lee Kemper is not an expert of mental health, he's an expert of consulting. So he would have to do the exact same thing that this person would do. And if we have a county employee who can do it, who we would trust, then we wouldn't even have to go to RFP.
Couldn't there be, I mean, it doesn't need to be one person necessarily. Wouldn't you want to have a representative from RQMS? Am I saying that right?
C.
Or QMC.
RQMC, or some of the other service providers?
Listen, we want the most credible information for Mendocino County we can possibly get. Mark, hold on one second. Carmel, go.
I was gonna say, I don't think we should use county staff. I really don't. I think that, you know, I think Janine is the best person to do this, but I don't think we should use Janine either. I really think we should use, if we're gonna have a needs assessment, we should use a consultant. You want somebody who is totally unbiased, who doesn't have a dog in the fight, and we can use county staff. But they could be the best staff, do the greatest job, it could still be problematic. I really think if we're gonna do a needs assessment, we should hire someone that can do this. And the thing about Lee Kemper is when he did the first one, Lee learned a lot about our system, or lack of, based on what he did. So, and he also ran CMSP for decades, so he knows.
CSNP is?
The County Medical Services Program, which is,
Okay.
we're one of 30 counties that does a small seat. We did anyway before ACA, but yeah, I mean, he would be a good person or someone like him. I think to use county staff would be a mistake.
Mark?
Yeah, I totally agree, is that we want an unbiased opinion, and we're not being fiscally responsible if we don't hire somebody to tell us what we need. I mean, $25,000, $50,000 and 30 million of spending resources is irresponsible.
Well then,
So that's, to me, we need to direct a needs assessment.
well then let's not
like
waste
Ross
time.
said.
Let's put someone in, make a motion, we'll get it to the Board of Supervisors.
But we need to, you know, what was important to me that I wanted to say is that we need to direct them. It's like we need to talk to each of the stakeholders involved and say, Lee, this is what we want you to do. Not just say, hey, Lee, go decide what you want to do with a needs assessment. I said, okay, you need to talk to the hospitals, you need to talk to mental health, you need to talk to the ASO providers, you need to talk to everyone that's involved. And then I want you to look at the program in general and see where we're missing. And am I the best person to do that? No, absolutely not. But between all of us, we should be able to hit those points and then give those to the board to create the RFP. And then we need this turned around quickly. It needs to be turned around within 90 days. So.
Hold on one second, because Jed was next.
That's all I have to say.
Jed?
Yeah, I'm agreeing with what Ross said, what you're saying. To me, asking the right questions is the important thing. And you're right, spending 25 or 30 or whatever to get the right questions answered is money well spent. But just as Janine was saying, you know a number of the questions that need to be asked. You know, Ace was talking about a number of questions that we know need to be asked. So that's what I think this group can do. I mean, and then it would be clear, hey, some of these things we already know. Some of these things we don't know. And we want, you know, whoever is going to do that to answer these questions for us. And we have some ideas, some direction, some guidance, some people we would want you to talk to. But I think the more you can guide anybody that's going to do that kind of evaluation, the better the result's going to be. Because, I mean, the reason we're doing this is so that we get feedback that's going to enable us to guide, you know, these very large expenditures of money that will be coming later about facilities and staffing and all of that. So that's my input.
Jan?
I think if the consultant is a professional, this is their method. They go and they interview each of the important stakeholders and compile that information. That's my understanding.
Okay, Ross?
So I think we're on the same page with Mark and Jed and myself. I want to extend it with a little bit of an anecdotal story. Robert McNamara was CEO of Ford. The president of Ford was Lee Iacocca, and Robert McNamara said to Lee Iacocca, if you can't justify it on building a new plant on a single page, then you don't need it. And what I'm getting at with that story is, I think if we start formulating the questions, the answers may well, just wait and see what the questions are, and they may well be self-answerable. You really might find, like, this is a no-brainer, right? Here's the questions, and we know what we need to do. And so for that, I'd like to make a motion that we, if it's too late.
No.
Can I do that?
Put it on the agenda?
And to put on the agenda the questions for, that we'd like to have researched for the next meeting.
So that doesn't need to be a motion. It'll be on the agenda for next month, that each commissioner is encouraged to think about specific things that they believe that we need that Measure B can provide. And remember, Measure B is a brick and mortar, and I don't want to get outside of what our scope and our responsibilities are. So each member, we all have our own responsibilities next month to come here and to talk about what we believe we need the consultant or whoever to do. And we may have members of Janine Miller's staff who can say, hey, listen, that's a great question. We have the answer. And that would not only save tax dollars, but it would be expedient to help us. Mark?
I would like to make a motion, if I may, to contract with the needs assessment and give direction at next meeting.
Make a motion
to authorize a needs assessment, because if we wait another 30 days,
okay,
then we go to, we're going to be 6 months before we even know.
So is your motion to recommend to the Board of Supervisors that they go out to RFP for a needs assessment?
Needs assessment, direction will be given in the needs assessment for the RFP from us.
But to at least get it started. So
Yes.
I want to read what you believe his motion is.
I need clarity, please.
Okay.
Yes, I would like to make a motion to authorize a needs assessment from the Kemper, what's the Kemper group called?
Kemper, but we're going to make a recommendation to the Board of Supervisors.
Yes, so Board of Supervisors to create an RFP.
Okay.
What is the Kemper group called?
Well, it's a Kemper report.
Yeah, Kemper group.
Well, the RFP would have to go out, and have to be a competitive process.
Yeah, I mean, we can't say for the Kemper,
That's
but
really
No,
good.
we can't contract with them?
Well, that's
Can't
separate.
specify it.
I don't know that we can make an argument for a sole source contract with Kemper. If we can, well, I don't know if we can, so,
Okay,
all right.
all right, RFP for a needs assessment.
all right, okay. So we have a motion to recommend to the Board of Supervisors a needs assessment for
Needs assessment for an RFP.
For the mental health facilities and the mental health
Complete system of
complete
care.
system. Thank you
system of
for
care,
helping.
complete system of care. Okay, good job. We're glad to
Yeah,
hear.
help,
Glad you
thanks
saw
for
it.
All right.
helping me.
Does everybody understand Mark's motion?
No, I don't understand it either.
I believe Mark's motion is to make that we're going to vote on to request the Board of Supervisors go out to RFP for a needs assessment to learn or to recommend to the county what mental health facilities and services, or no, mental health facilities that Measure B provides for are needed for the basic services.
Mark, did you want to include in that some of the questions that you want to see in the RFP?
I think the questions need to come from all of us, basically, but I would like to get
Get started.
get the board to authorize that, and us as a committee to give direction. So if you guys can help me create a motion.
It should, in my opinion, it should be for the whole system of care.
Absolutely.
I mean, in my opinion, that should be how it is, because not just buildings, everything. So that we know, because we're in charge of 25% of services too.
I have an RFP that I've drafted in three states, and this might help us better communicate it. Provide an assessment of mental facilities needed to provide proper services of the currently mentally ill patients. Coordinate a needs assessment for infrastructure and services from behavioral health/mental health and its contractors. Assessment from Mendocino County Corrections and law enforcement, healthcare providers, and a cross-section of staff that support these services.
Well, Good job.
I mean, that's basically what
That's
we're asking
beautiful.
for. I mean, that's what we're asking
All
for,
right.
That's
but I don't know how to
beautiful.
create that.
And
So,
add peers
emotion.
and family members in there, and you got it.
Yeah.
So do we need to tell them or recommend that they have an RFP, or can we just recommend that they?
for a needs assessment.
A needs, yeah. for a
We would
needs
just recommend for a
assessment.
needs assessment.
And
That's
when
what
do
we
they
need to
do it?
I would
recommend.
like for that piece of paper, if you don't mind, to get to the clerk so she can put in the notes
Absolutely,
what the motion is.
absolutely.
Okay,
You want to read that back?
well,
Do you want me to play it?
No.
all right, so we've heard, there is a motion on the board, or in the room,
On the floor.
on the floor, thank you. Is there a second?
What is the motion?
Yeah, try to read that one again.
It's what he just said.
No.
You want me to read it? I think we need a motion for a needs assessment,
To
Okay.
recommend the board of supervisors
for a needs assessment.
Okay,
of the mental health system.
The mental health system.
Sounds great. Mendocino County Health, mental health system and facilities.
okay,
Can I ask a point of clarification?
sure.
I'm concerned that if we're asking for a needs assessment that's so broad that we're going to miss the core of what we know our priority is, which is for a kind of residential program, inpatient facility that Ace talked about, Janine and Carmel talked about. And to me, that's the initial needs assessment that I think needs to happen. There are other parts, like the broader things of a broader system, but I would like to see that one done first before we get so broad that it would be looking at everything.
So I think
Doctor,
I
yes.
think we're talking about two different things, and that's what I was trying to get at earlier. Now we have a group that's going to go out and research the type of crisis facility we need, and I think we can ask for a broad total needs assessment while proceeding with what we know we need in order to keep people out of the jails and the emergency room and locked facility and sending people out of county. I mean, I think we can go ahead with looking at this possible locked facility while asking for a needs assessment.
Jan?
We could recommend a needs assessment for the whole system of care with a recommendation for the most appropriate facility.
I mean, the crisis facility, but I mean, I think that's what your ad hoc committee is doing, is to look at
I'm saying the most appropriate facilities. We're not saying what kind of facilities are most needed because we don't have the needs assessment.
Okay, so we have a motion on the floor, we do not have a second. Is there a second, or we're going to withdraw the motion and go to another motion?
The motion is to do a needs assessment on the whole mental health system, is that right?
Yes?
I second the motion.
Okay, wait, so the wording is, I'm just going to wordsmith, what you just said wasn't the original motion.
Okay, so my apologies. One more time, Mark.
I'm sorry I made a motion.
No.
Hang in there.
So do
We're
I-
close, we're
You're
close.
Basically what he said.
All right.
Wait, hold on a second. Okay, Mark, you have a motion on the floor. If we want to have, we don't have a second. If you want to redo it, then all you have to do is say withdraw the motion, and then you can say the second one.
Withdraw the motion.
Okay?
You make a motion and I'll second it.
I thought you had a really good motion, I'm sorry.
So what's the motion?
The motion is to make a recommendation to the Board of Supervisors from this Citizens Commission to go out for RFP for a needs assessment of the whole mental health system in Mendocino County.
Okay?
Is that right?
I second.
So we have a motion, a second. Is there any citizen comment? By all means, if you could state your name, please.
My name is Stephanie, and I'm a resident of Ukiah, and I have bipolar 1. And I have a lot of information that I think you guys could probably use. One of the assessment needs would be nice to ask me and my peers what we need as a hospital. Because currently I am a chronic relapser for hospitals. Last year I was hospitalized 3 times. I went to Santa Rosa twice, and then I went to San Elena Vallejo once. And the care that I got at different hospitals are quite different. The one in Vallejo, San Elena met all my needs that I met. It was the most productive one that I've been in. I think I've been in like 8 over like the last 5. And when I go into the hospital, I'm there like 5 hours usually, sometimes overnight. And then I am transported by an ambulance to get there, not a taxi or anything like that, or a crisis worker, which I used to be. I used to transport people. But the cost of an ambulance coming to get me or to take me down there is, you know, all the money is coming out of our county and going somewhere else. And it'd be nice to have all that money coming back in. So it's other money you guys can also consider for your assessment needs and whatever all you're doing here. But I really would like to have you guys, one of you, I don't care who it is, come and have a meeting for those of us who have mental health issues of all varieties, all incomes and all levels. That would be, let us introduce you to what we need, which is extremely important because you're building it for us. And it's not just for the homeless either. Some people get really offended that homeless is always, and seems like it's the only, not the only thing, but more prominent than anybody else. And there's people who have mental illness who have high insurance who also have to go out of the county also. So if you take that into consideration, that'd be very well. Thank you.
Any other public comment?
Just had a question, is there an us, a group that you represent, or how would we talk to you if we wanted to?
Wait, hold on a second. At the end of this meeting, can you guys get together? We have a motion on the table, and we had public comments.
Great, thank you.
All right, so we have a motion on the table. Is there any comment? Jed?
I don't want to, I think it's a good motion. I just want to be sure that what we're asking a consultant to do is focused on what the charge of this group
Yes.
is.
We are.
That it isn't mental health everything, because that's not what this group is charged to do. So that's the only piece I want to be sure gets included, not everything that's possible in mental health.
I think that'll be properly relayed to whoever responds to the RFP.
Okay.
And we don't know if anybody will respond to the RFP, honestly.
That's true.
So, we have a motion on the table. We have a second. We've had public comment. Any other questions? All in favor, say aye.
Aye.
Aye. Any opposed? Okay, it was a unanimous, and thank you. Thank you for that. So we'll make the recommendation in agendized form. I will work with Carmel on this to get it on the agenda. And it'll be in approximately 3 weeks on the Board of Supervisors meeting. Okay? All right, so now we're going to go into the committee member reports. If you had a chance to attend any of the Brown Act training or anything, or any other mental health meeting that relates to this commission, by all means. Janine?
Well, I always attend the Behavioral Health Advisory Board meetings, so we have those monthly, and so I attended those meetings. I did do my Brown Act training, and I'm looking at you. And then obviously put some stuff together for the presentation.
Okay, thank you. Jan?
Well, I attended 6 or 7 different meetings from the state to the local level on mental health within the last month.
Thank you. Carmel?
Tom, I have nothing to report. I have a 3 o'clock meeting I need to leave, but I do have one question about Brown Act. Since our county council's here, not everybody on this committee needs to take a Brown Act training, right? Only take a Brown Act training if you haven't ever had one. Is that right?
So I was talking about I was asked to by Dora what the mandates and who reports, and the laws are very strange in this area. But as I understand it, even though this is a Brown Act commission, there is nothing, because there is no compensation given for anyone. It's not a mandated requirement as far as I can see.
So if you need a Brown Act training, you're doing Brown Act trainings. But if you don't need one, you understand the Brown Act because you've been involved in other committees, you do not need to take it.
I would say that was a fair assessment.
Okay, so there's no legal requirement to attend the Brown Act, but it's certainly good to go, good knowledge. Doctor? Report out of committee, Ross? Lloyd?
Nothing?
And Lloyd, when, I'll talk after me.
Okay.
Mark?
Just attended the Brown Act.
I was there, I saw you.
Yep.
Saw me. Jed?
Yeah, I did too, and it was a good training. I was glad I did it. It was well worth your time, thanks.
Shannon?
I have nothing to report.
Donna?
I did not take the Brown training.
Okay, well, I attended Brown Act and it was good, and I appreciate county council doing it. And so our next meeting is March 28th in this room at 1 p.m. Thank you very much. Okay.